before we start our assessment, we've already come in, gotten vital signs, assessed gait, and all of that. So we're going to come in. Hi, my name is Brent. I'm your student nurse today. We're going to go through a quick head-to-toe assessment. Can I go ahead and check your name and your date of birth for me, please? All right, your name? All right, thank you very much. We're going to shut the door for privacy, wash our hands, and we're going to start our assessment. Skin is evenly distributed. Color is consistent with genetic background and sun exposure. It is warm to the touch, relatively smooth, not excessively moist. Skin turgor is normal, which indicates that you're not dehydrated. We go on to your head. It's normal cephalic, erect, and midline. Your hair is evenly distributed. I'm going to go ahead and palpate you. Let me know if you have any tenderness or pain. No tenderness noted. No swelling, no masses, no abrasions, no edema. Go ahead and come down to your sinuses, your maxillary and your frontal sinuses. Any tenderness? All right, so no tenderness, no edema, just a little bit of pressure. All right, while we're here, we can go ahead and assess your eyes. Your eyebrows are evenly distributed, eyelashes evenly distributed, eyelids are no lesions, no edema. Your eyes are bright and clear. Your eyeballs are not protruding. Your pupils are 4 millimeters, clear. Iris is brown, circle and symmetrical. Sclera is white and intact. Cornea is clear. Go ahead and look up for me. Your conjunctiva is pink and moist. All right, if I can go ahead and get you to close your eyes and smile, puffy cheeks, do all that kind of stuff. All right, resist tension on your finger. All right, cranial nerve 5 is intact. Close your eyes, tell me when you feel something. No. All right, cranial nerve 7 is also intact. Go ahead and do your TMJ. Go ahead and open and close, open and close. No crepitation, no pain, no tenderness. Going to go ahead and look in your nose while we're here, then we'll do all that stuff at one time. So your nose is midline and symmetrical. If you look back for me. Nasal mucosa is pink and moist. Your septum is intact, midline, and not deviated. Your turbinates are pink, moist, and intact. Right, go ahead and do your mouth real quick. Your lips are pink and symmetrical. Go ahead and put some gloves on while I do this. You can open up for me. Your buccal mucosa is pink and moist. Your uvula is intact, symmetrical, and rises symmetrically. Your tonsils are present at 2+. Come on, help me out here. Sorry. All right, the gag reflex is present. We've got your Borg's duct, tensor duct, your teeth, 28 teeth. Your frenulum is intact. Your tongue is mobile. Let's see what else we got in here. I think I already said frenulum. But that says that cranial nerve 9, 10, and 12 are intact, I believe. What else are we doing? Let me get some alcohol. If you will, close your eyes for me. Tell me what you smell. All right, tell me what you smell. All right, cranial nerve 1 is intact. Slide over here. Let's do this. Go ahead and look into your eyes. That's good. And we'll use the pen light. All right, eyes dilate, which means both eyes are in perla, so that cranial nerve 2 is intact. Let's see here. Got your nose, got your mouth. Go ahead and look into your ears. Alright, the ears are level with the eyes. They're symmetrical and bilateral. We know if you have any pain or tenderness as I palpate the tragus and the mastoid process. No pain. Alright, we're going to turn your head this way a little bit. Look into the ear canal. It's clear. The cone of light is at the 5 o'clock for the right side. If we're at the left, it would be at the 7 o'clock. Your tympanic membrane is shiny, pearly gray, intact, no edema, no protrusions. Your umbo is is present and your pans is present. Alright. Let's see, we got through all that. Let's go ahead and come back this way, let's do your eye test real quick. Jumping around a little bit, so we're knocking it up. Alright, cover one eye. Read it.
95874.
Alright, other eye.
95874.
Alright, you have 20/20 vision, which is what you can see at 20 feet, what other people can see at 20 feet. I'm going to do my Weber and my Rene test real quick for your hearing. Put this on top of your head, tell me if you can hear it equally through both ears. Alright, and then tell me when you can't hear it anymore behind on your mastoid process.
No.
Alright, what about now?
No.
Alright, so that states that your bone conduction is half the length of air conduction, which tells us that cranial nerve 8 is intact. Let's see here. Go ahead and do the whisper test, so cover one ear and repeat what you hear.
1, 2, 3. 86.
Alright. Cranial nerve 8 is also intact. Go ahead and go on to the neck. Alright, your trachea is midline. Go ahead and palpate your nodes. We've got, let me know if you have any tenderness. Preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. We've also got the occipital. Any tenderness? Alright, no tenderness, they weren't palpated. That means there's no edema. Go ahead and come behind you. If you can tilt your head down for me and swallow. Alright. The thyroid was not palpable, which means there's no swelling, which is good. Go on and go to your chest. If I can get you to turn your feet over here, just so we can do your posterior chest. Alright, the thorax is symmetrical. She is holding her own weight with herself without any issues, not supporting herself with her arms. I am going to palpate, and what I'm going to need you to do every time I say 99, I need you to say 99 every time I put my hands on your back, okay? Alright?
99.
Alright, your tactile fremitis is good. We had equal bilateral all the way through. I'm going to percuss all the way through and just check for resonance or opposite, or not that. We have visceral resonance all the way through. Go ahead and palpate all the way through. Any pain? Alright. We're going to auscultate all lung fields. So if I can just get you to breathe deep. Alright, posterior breath sounds are all clear, no adventitious sounds. So we're going to go ahead and move around to the posterior. So go turn around for me, please. And kind of catty corner to the camera, if you don't mind. Alright. Do the anterior. Let me come up through your shirt. If you just breathe normal for me. In all quadrants, or all portions of the lungs, we have clear breath sounds, no adventitious sounds anteriorly. Going to go ahead and listen to the heart. We've got the aortic, pulmonic. Those are both in the second intercostal space. Aortic's on the right side of the sternum and the pulmonic on the left. Go ahead and go through the bottom to get your tricuspid in the 5th intercostal space. And your mitral around the side. We had no murmurs, no thrills. It was just a good, solid, strong heartbeat, good pulse. S1 and S2 are both present, S1 being louder than S2 in the lub dub. And that should be all for the heart. And we are going to go ahead and do the abdomen while we're here. So if you'll lay down for me. And slide this way, just put your hang your legs off. Pull this up real quick. Sorry. Alright, first thing we want to do is inspect. We've got a flat abdomen. There is no protrusion, no lesions, no cuts, no abrasions. Any pain, no pain. Skin is consistent in color with genetic background and sun exposure. We're going to auscultate all 4 quadrants of the abdomen, starting in the lower right, upper right, all right, we've got active bowel sounds in all 4 quadrants. Going to go ahead and auscultate the blood vessels of the abdomen, which starts with the aortic, the renal, the iliac, and the femoral. And there's no sounds in the lower blood vessels, which is good, no bruits. So we're going to percuss all 4 quadrants. Alright, we had a dullness over the organs, especially the liver, and a general tympany throughout the rest of the abdomen and over the stomach. Go ahead and do some light palpation all the way through. Any tenderness, any pain? No? Okay. Alright. No mass is noted. Alright, discrepancies. We're going to do some deep palpation. Any pain? Just a little uneasiness? Alright, take a deep breath for me. We're going to palpate the liver. Alright, and deep breath. And the spleen. Alright, spleen's not palpable. Liver is in place. And deep breath for me. And the kidneys are in place. Alright, that should be that. You can go ahead and sit up for me. Alright. Let's see. Alright. Actually, let me get you to lay back down real quick. Let me do your carotid arteries. If you'll turn your head to the side. Carotid artery pulse is strong, 2+, and I'm going to go ahead and listen to you. And there's no bruits in the carotid artery. Do the brachial, radial. Come this way, slide this way for me. The paralysis pedis and the posterior tibial, and they're all 2+ pulse and strong. You need to sit up for me. Alright, sit in there. Alright, we've got head, ears, abdomen, pulse. Cranial nerve 11. If I can get you to shrug your shoulders for me. Turn your head to the left. Turn your head to the right. That indicates the cranial nerve 11 is intact. Go ahead and stand up for me real quick. Go through your range of motions. So I'm going to stand on your left. What I need you to do is turn your head down, chin to your neck, back to the sky, left, right, all the way around. All right, no crepitation in your range of motion during flexion, extension, lateral bends, and rotation. We can go ahead and do your shoulder, up, cross, behind, and all the way around, please, ma'am. All right, so no crepitation or clicking in that either during abduction, adduction, flexion, rotation, internal, external, all that. Go ahead and do your elbows. Flex it for me. All right, extend it all the way around. We're good there. Same thing with your elbows and your wrists all the way around. Full range of motion. Pick your leg up for me. Extend, flex, and out with your hips. All right. Full range of motion with flexion and extension as well in the knee. And with the foot, get your gas pedal. Take it off the gas pedal. All right, invert, exvert. All right. Full range of motion with the ankle as well. I guess you stand with your feet side by side, arms by your side, and close your eyes for 30 seconds. All right, the wrong bird test states that we have good balance. All right, you're good. And I need you to do a tandem walk, heel to toe, all the way through, and then backwards a couple steps. All right, that also shows that you have good balance. All right, take your fingers to your thumbs, back and forth. All right, it's coordination. It's a coordination test. And then I need you to close your eyes. I'm going to put something in your hand. If you can tell me what it is, please.
Penny.
It's a coin. Okay. So your stereognosis test, and then I'm going to draw something in your hand if you can tell me what it is.
A 7.
All right. And your Grefty. We've got a good century. Just sit back down for me. Let me think of what I'm missing. Actually, I'm about to use one of my checks to see what we got. All right, so we need to do our CVT, our reflexes, and that right there. All right, so in the chest cavity, our epilaterals 1 to 2, our intercostals are 90 degrees. I don't know if I stated that earlier, but if I can get you to, I'm going to do my reflexes real quick. All right, you're going to do your tricep, so just relax. All right. Bicep. All right. Patellar. And your Achilles. All right. We've got all 4 reflexes are present in the 2+. If you'll turn around, let me see your back real quick. You should feel a thud but no pain on your CVT test. No pain, no tenderness? Okay. Let's use it twice. So when you do the strength, focus. Yeah, strength, focus should be good. All right. Let me add them real quick. Let me. The umbilicus is also midline and inverted, just so we got that noted in there. And then your muscular test. If you can sit up. Put your arms at 90 degree. Push to me. Pull against me. Alright. And slide a little bit to the side of the legs. Push to me. Pull against me. Alright. We've got a +5 on the muscular skeletal, on strength on all 4. Yeah, I think that should be it. I mean, yeah, we're good. That's going to conclude our assessment of the day.
Red button, turn it off.
Yes, sir.